Heart failure has become a significant public health problem with rapidly rising incidence of heart failure in this country. If you see overall incidence, there are 1 to 2% of adult population is suffering from heart failure. Especially in developing countries, the incidence is rapidly increasing. Due to increased incidence, the prevalence also increasing. If you take people who are above 75 years, the tenfold increase in incidence of heart failure you see in this population. Because it's rapidly increasing and also more disabling, we need to treat these patients with more accuracy in diagnosis and also the management. The many social aspects and also the economical aspect of the heart failure can create problem in managing these patients. What we are looking at heart failure patients is improving the outcome among heart failure patients, as they carry very high risk of sudden cardiac death and also a progressive heart failure leading to advanced heart failure or resistant heart failure requiring major therapy that should be avoided. Our aim is to improve medical therapy, improve compliance of the patient, and improve dietary management and exercise, and also to avoid smoking and heavy alcohol consumption. These non-pharmacological measures like diet and nutrition is very important. It's always to consume less than 2 grams of salt per day. We call it as low salt diet because each gram of salt can hold 200 ml of water. So taking less salt, it prevents waterlogging in the body. And also to avoid weight gain and to consume low calorie diet. There are some salt replacement by potassium salt. They should be careful because this can cause high potassium level in the body, especially when they are suffering from kidney disorder or some of the medication like ACE inhibitor, ERBs and ARNI, which can increase potassium in the blood. Rest and exercise is very controversial among patients but not among doctors. Traditionally, heart failure patients are advised rest, but now this rest is restricted only to acute heart failure patient. Those who are chronic heart failure and stable, all these patients should encourage to do exercise. Many studies are done to see the advantage of exercise among these patients. The exercise will improve symptoms and also prevent sudden cardiac death among these patients. Another most important part of heart failure management is self-care. Self-care can prevent recurrent admission and also improve compliance among these patients with the therapy. The symptom recognition and weight gain recognition should be part of the education what we give to patients with heart failure. If they gain 2 kgs of weight in 3 days, they should report to hospital immediately. There should be a system in hospital where nurses are trying to follow up these patients who are discharged from hospital. If we do this, we can avoid many admissions, thereby can prevent economic loss to the patient among this subset. There are many other lifestyle modifications which is required to prevent progression of the disease and also to prevent recurrent admission to hospital. These include you should quit from smoking and take influenza and pneumococcal vaccine regularly, and those who snore should take CPAP to improve daily functional capacity, and non-pharmacological testing like stress reduction can be considered as usual adjuvant to reducing anxiety among this patient by health education. So drug counseling is very important. Patients should be compliant with the treatment what we give. Otherwise, some patients, because they are chronic heart failure, they try to modify their medication themselves and land up in trouble. Adequate disease management is another important aspect of heart failure management. These patients should be managed in a heart failure clinic where not only doctors and also the paramedical staff have a knowledge of managing heart failure so that they get best therapy in this situation.